to put the resources for a care economy. We want to obviously address the crisis that exists in childcare and in elder care and senior care. We obviously think it is important for us to think about infrastructure in the 21st century sort of way. We don't just want to have infrastructure be defined by the normal standards of roads and bridges and pipes, but infrastructure that addresses our climate crisis, infrastructure when it comes to addressing broadband infrastructure, when it comes to addressing our healthcare infrastructure, the school buildings, housing, and all of those other things. And so, as many of you know, I serve as the whip of the Progressive Caucus, and we've worked really hard to try to get our caucus, which is the largest caucus of the Democratic caucus in the House, to come together, almost 100 members, to figure out 5 priorities in addressing housing, childcare, the climate crisis, healthcare, and immigration. And so we've been negotiating with Speaker Pelosi, Leader Schumer, the White House, and the chairs of the Budget Committee, both in the Senate, Chairman Sanders, and the House Chairman Yarmouth. And so we feel comfortable right now that we are going to get both of these bills moved simultaneously. We haven't really had a serious conversation about the specific dollar amount that will go into the reconciliation bill. But we think we have a commitment on what the details will look like in regards to the inclusion of our priorities. So we'll continue to push for that. There's a lot that has happened in the last 3 days since the bipartisan infrastructure deal was reached by the White House and Senate Democrats and Republicans. And we feel really comfortable right now that a deal will be formalized in regards to a reconciliation piece in the next couple of days. And so the Senate is going into recess for 2 weeks. And we think the last 2 weeks of July will be fruitful in us producing these pieces of legislation and hopefully sending them to the desk of the president early August.
Excellent. Thank you, Congresswoman. First, as part of our town hall this evening, we have Dr. Bhaskaran here, who has worked with our office on a constituent service issue. How are you, Doctor?
We can't hear you. You're muted. We're still in pandemic phase, even though we've been using technology, still having challenges in figuring it out.
Can you hear me now?
Yes.
Okay, great. Thank you. I'm doing well, and very nice to see both of you here. And thank you, especially Representative Omar, that you've helped me a lot in personally getting through the immigration problem that I was dealing with. So thank you very, very much.
You're welcome.
I thought I'd share my experience of what really happened. So I'm a physician. I'm an infectious disease physician. I work at the University of Minnesota, take care of COVID patients, and run a post-COVID clinic with my colleagues. And what happened was, so I was on a work visa, so a H-1B visa, which was expiring in April 2021. My 6 years were up. So that I can continue to stay in the US and continue working, I'd applied for a green card in November of 2020 with a plan to get an EAD or a work permit once the green card was approved, but before I could have it in hand so that I can continue to work. So that was the plan. So I applied November first week. So I had about 6 months time to get this sorted out, and so that I can continue staying here and continuing to work. But what happened was there was a very unusual delay from USCIS in processing the document itself. So a receipt notice for the green card application, which usually takes about 2 to 4 weeks, took 5 months. So for 5 months, we didn't hear anything, and this was, it seems, very unusual. That's what we heard from our attorneys, that they haven't encountered this before. So that really threw us off, and I didn't know what I was going to do. But I'm glad that at least before the deadline, I got the receipt notice, so we were able to do premium processing and at least get the green card approved. But I couldn't work till my work permit was approved, and that, according to present processing times, looks like it's about 6 months. So I would basically be without work for 6 months and not deliver the services that are required. So I heard from a friend that that congressional representative can actually do expedited processing on behalf of candidates, and so I contacted Representative Ilhan Omar's office, and they were so responsive. I can't even thank them enough for that. Within a few hours, I heard back. So I emailed them, and within a few hours, I heard back. Sorry, there is actually sun on my face, so excuse me. So I heard back within a few hours, and they told me what paperwork I needed to do and the details about it. So I got a letter from my department, and they were in touch with me. And in fact, it seems USCIS was not considering it. So because I take care of COVID patients, this is a category where expedited processing can be done. And so in the interest of the community. And so they worked with the USCIS office, but I think there was a little bit of pushback. But Nikki in Representative Omar's office was so good, and she called them, and I know multiple times, and then got an earlier biometric appointment, and actually it's just been a month, and I have my work permit card in hand. So thank you. According to their website, so 5.5 to 7.5 months is the time frame that they have given. And I just got it in a month after contacting your office. So thank you so much, Representative Omar. I'm deeply grateful, and you and your office went above and beyond to help me out, and I appreciate your good heart and goodwill. Thank you so much.
Well, thank you, Doc. I think we oftentimes, are so focused on the policy work that's getting done and the politics that's involved in being a member of Congress, that oftentimes these stories, of the constituent service that our office does isn't spotlighted. And so I'm surprised that you're here to share it, and I just think it's really great. I think that for those of you who are in the community who have immigration cases that are challenging, please reach out to our office. We do work for you, and we'll work to expedite and make sure that the process is simplified and that the system is working for you. We also do that in all of the cases or the needs that have to do with federal offices. So we do work around Social Security benefits and access. We do a lot of work with our veterans in supporting them. And so if there, federal grants, anything that you need to find support for federal funding or with a federal agency, our office is there to lend you a hand. And I just, again, am reminded that the first time we'd met virtually, was when we did our first town hall, right when COVID started and the pandemic was raging, and taking away so many of our loved ones in our community. As you know, Doc, I lost my father to COVID, and it's caused so much destruction in our communities. And you were one of those essential, extremely essential workers. I remember you joined us from your hospital with your hospital gown to share your story and just how important it was. And I wanted to thank you, and just let you know that one of the immigration bills and policies that we are fighting for is to create a pathway to residency and citizenship for essential workers. And I think we've all as members of Congress talked about how important our essential workers were in trying to help us deal with the pandemic and making sure that we as a country were resilient. And as we say, it is important for us to take care of those who cared for us. And it's going to be really important for us to fight for essential workers who are either undocumented or looking to stabilize their status. So thank you so much for sharing that story.
Oh, thank you. I will be eternally grateful. Thank you so much.
Wonderful.
Congresswoman, should we go to our one of our next questions?
Of course.
Okay. I think next we're going to go to Farhia. Has Farhia joined the panelist room? Going to be just
while we wait for here, maybe I can give a quick update on some of the immigration policies that we've been fighting for since the doc just joined us. As many of you know, we already passed the Dream and Promise Act, which is a really essential piece of legislation. We passed a bill to get farmers to stabilize their status and have a pathway to residency and citizenship. But there's a big bill called the Citizenship Act that is currently being introduced and advocated for to be included in some of the packages that are moving along in the House and in the Senate. It's an important piece because it puts all of those pieces of immigration policy changes that we are trying to make and combines it into one piece of legislation. It includes the No Ban Act, which we passed as well, that sort of puts the Muslim ban in the dustbin of history and makes sure no president will ever be able to do that again in our country. It has the Promise and the Dream and Promise Act. And I think it's going to be really great because it does create a pathway to residency and citizenship for so many of our undocumented brothers and sisters in this country. Assalamu alaikum.
Alaikum assalam, mashallah. I'm so glad to share this space with you, Abayo. So good to see you again. And Doctor is right, your staff is amazing. Alhamdulillah, they are so amazing and so responsive. I'm just so happy to connect with you again. As you know, I'm a woman in long-term recovery, and what that means to me is I can be a productive member of society. I can have a healthy relationship with my family. Recovery, wallahi, has been able to give me back my values and my traditions. It means being courageous enough to share my recovery story to help reduce the shame and stigma in our community. I'm here before you today to advocate for culturally responsive peer recovery support for our BIPOC communities. As you know, due to the opioid epidemic, our community lacks appropriate and adequate recovery support. I just wanted to also network with you again to see how we may be able to work together, inshallah.
Yeah. Well, I think Farhia, there's a roundtable that's being set up for us soon when I'm home for us to have a conversation. I know that in our last conversation, I told you about the roundtable that we had with other young people who are in recovery, who are helping others find their way into recovery, and who are amazing advocates like yourself, who are sharing their stories and trying to make sure that this pandemic that's especially devastating our community and communities of color has access to the resources that exist within our community. There's obviously pieces of legislation that have been passed to address the opioid crisis. Those pieces of legislation came with resources. There is a lot of help that is out there, trying to center those resources in community and make sure that the treatment that is out there is culturally specific and tailored to communities that deal with just the extra layer of stigma that culturally exists. This is a really important piece, and one that I want to work with our county commissioners and our municipal leaders and healthcare providers in trying to make sure it's done. And with you at the table, I think we'll be able to be successful. I know that Council Member Osman recently proposed an amendment to the Minneapolis city budget to allocate resources. I was disappointed to see that amendment be tabled. And this is a conversation that my team will have with the other leaders on the city council and the mayor to make sure that the resources that the city council member wanted to allocate to the East African community and to the Latino community and the Native American community, who are disproportionately being impacted by opioids. Our children are essentially dying in numbers that are hard to even think about. And so, you know that we think about this a lot. We talk to people about this a lot, and we'll continue to work on that. And as I told you on the cultural piece, as a Somali, as a mom, as somebody who grew up in this country and lived through the teenage battles we have with our parents, I have been able to lead some conversations with our religious leaders, with our elders, with community leaders to look and address what our kids and young people are going through in our communities through a lens of compassion and empathy and understanding. We're living in a different space. We are existing in a culture that makes it hard for a lot of our young people who have come from refugee camps, who've survived war, who have lived through a lot of trauma, to get the necessary resources they need in order to deal with that trauma and to heal. Naturally, a lot of people do turn to opioids and substance abuse to suppress a lot of what they're dealing with. And I think that there's just a lack of understanding with, some of our religious leaders and some of our elders and moms and dads. And there is a lot that we can do, those of us who are a generation older than you and yourself and the next generation to you that will have your struggles and even bigger struggles, because I know my struggles as a teenager, adopting and dealing with a lot of the PTSD that I had are very different and more profound in the struggles that you went through. And I know that it is certainly true for the younger generation as well. So thank you for your partnership, for your advocacy, and I look forward to seeing you when I'm home for us to have an in-person discussion.
Inshallah, I look forward to it too. Come home safe, inshallah.
Thank you, Farhia. Thank you, Congresswoman. Again, welcome to our 5th Congressional District Town Hall with Congresswoman Ilhan Omar. Our next 3 questions are going to come in this order from Willie Wilson, Shannon Anderson, and Sonia Isaacson. Next, we'll have Willie Wilson join us. Willie, are you there?
Yeah, I'm here.
Welcome, Willie. How are you? Do you have a question for the Congresswoman?
Yeah, I do. How you guys doing today?
Doing good, Willie. How are you? Can't see your face.
How do I do that?
Turn your camera on.
Does
No?
it say start video?
Yeah, it's not giving me an option to do that. It just says mute, raise hand, chat, Q&A, and more.
Okay.
Go ahead. That's okay.
Now I can.
Oh, there you go. Oh, sorry, didn't mean to.
My name is Willie Wilson. I go to North Minneapolis. I go to North Community High School, right by North Commons. And my question was just that. So summer's coming up, and it's gonna be hot out, and everybody's gonna be out of school, and it's gonna be like our first time back outside since the pandemic. And I just want to know what you can do to help me have a fun summer and a fit summer around my community.
Well, that's a really great question, Willie. I think it is an undisputed fact that Northside it has been continually ignored by the city, the county, and the state. And it's been really important to us to make sure that we are centering Northside in our conversations, whether it is to try to get resources to young people, advocating for businesses in business corridors in North Minneapolis, or whether it is addressing the housing crisis and landlords who take advantage of people who are renters in North Minneapolis. We've put in a request, $2 million to uplift and develop in our community projects request for North Commons. And it's been something that's really important to us. We've also been trying to make sure that the American Rescue Plan funds can be used to utilize those resources in creating activities for young people in North Minneapolis, and trying to make sure our parks are accessible and have activities, and in addressing the rise of crime as well. The president recently also announced a plan to put resources into these communities, and we'll try to make sure that those resources are coming to communities like North Minneapolis as well. It is an important thing for me as a mother of young people. My son is 15 and is currently not only seeking in employment, but is actively thinking about parks and community activities that he can do to try to make sure that his summer is safe. We live in and near the See the Riverside community, and that's again another area that is neglected, that is not resourceful, and oftentimes doesn't have a lot of activities and resources for young people. And so this is something I'm committed to doing, and just really feel grateful for your voice and for your advocacy.
Thank you.
Thank you, Willie. Our next question will come from Shannon Anderson. Shannon. Andreessen. Did I pronounce that improperly? I'm sorry. Go ahead, unmute and go ahead, Shannon.
Hi, thank you. Sorry about that. It took me a while. Yes, my last name is Andreessen. I'm your Norwegian cousin. So thank you so much for having this town hall and for taking my question. I'm really excited to be a part of this evening. I am wondering, I serve on the Hopkins School Board and wanted to thank you, Representative Omar, for visiting one of our schools last summer while we were serving meals to families at Alice Smith during the pandemic. And I, since then, have been advocating on the state level for fully funded school nutrition departments. And when I saw your bill for the Universal School Meals Program Act, I was really excited because what I hear from state lawmakers is that they expect this sort of action to come from the federal government. And so your action on that is going to be really impactful for schools as we continue to move forward with feeding our families and making sure that every child has the nutrition they need to thrive in our communities. So I am wondering, how can we as a community help advocate for the passage of your bill? And also the thing that I am hearing from our head of our nutrition department is that the reimbursement rate isn't quite as high as it needs to be to fully fund our nutrition department. So wondering how we can advocate for more funding on the reimbursement rate and also to get this really crucial bill passed through Congress.
Well, Shannon, thank you, and it's good to see you again. I remember when we were there, every family, regardless of what their status was and their income, could come by and get a meal for themselves and for their children. And the reason we were able to do that is because my bill, the Meals Act, that passed with the first COVID relief bill that we did back on March 27th, 2020. And what has been really important and very visible to a lot of our naysayers in regards to the universality of school meals plan is that we are already doing it and it hasn't been problematic. And so many people have appreciated, a lot of school districts have asked for us to expand it and to renew the bill's authorization so that they can continue to do that. But obviously it is a pandemic related piece of legislation. And there's a lot of really good pandemic related things that we have done that should continue, because we are now realizing that this is what our communities have been asking for and what is actually impactful in regards to developing policy and finding solutions. So today, actually, I was talking to the White House and I brought up the fact that, My Meals Act has been utilized by every school district across the country. Children and families have been fed. Obviously, a universal school meals bill does not feed families, and it doesn't allow for families to take the food from the schools, which is different from what the Meals Act did, because it was a pandemic and you weren't expected to show up in the school and eat in the school. Is that there was less administrative cost, and that I think allows for the cost of feeding families and children to come down. And so we'll continue to advocate. We've had sort of 2 committee hearings on the importance of creating a universal school meals plan. Right now, obviously, everybody's debating about the price tag that's associated with it. But with people like you and others, it is going to become evident that the stories that are being shared by school board leaders in our communities, by families in our communities, by children in our communities, is going to mute the cost that's associated with it, because it is a great program and our children do deserve to have a meal guaranteed to them at least once a day. And so the best way that you can help is, working with your colleagues and families in your school district to send letters and emails to my colleagues on the Education and Labor Committee, because that's where the bill sits. And it would be really nice for people to hear, from their constituents, from my constituents, on the importance of advocating for this piece of legislation, signing on to it, and helping us get a markup and pass it out of committee.
Wonderful, thank you.
Thank you, Shannon. The next question, Sonia was with us but had to leave. So I'll go ahead and ask this for Sonia. And Sonia's 12-year-old, first of all, has a question for you, Congresswoman. How are you?
I'm tired, but I'm okay. Thank you for asking Sonia's 12-year-old. What's the name of Sonia's 12-year-old?
Well, if Sonia types that here, we will tell you in just a second.
Well, I appreciate
Alice.
Alice. Appreciate you, Alice. Thank you so much for asking. I feel like that is the number one question people ask, and it makes me feel cared for and loved, and I really do appreciate representing a district that is full of people who are compassionate, but also, living in a world where people do care about how others are doing. So just thank you.
And then Alice's mom, Sonia, had a second part to the question, which is, I'm interested in student loans and overhauling the whole price of college education. And she also said she's advocating for free school meals for all K through 12 students, as you just talked about. But I think the question has to do with college education and tuition.
Yeah, did she also have a question on EBT?
Yes.
Electronic benefits as well?
Correct.
Okay. I really appreciate your multi-layered care question. I think those are really all important issues that help provide resources to the most unfortunate or most vulnerable in our communities. During the pandemic, we fought really hard with the USDA and Food and Nutrition Services to approve Minnesota's plan to provide a pandemic electronic benefits transfer so that people were able to have resources in our schools to be able to eat, and people were able to order using their EBT cards, meals to their homes as well. And so I am glad that those resources have been out there and that we've been able to successfully fight for them, because it is essentially about families and our children. We continue to work and push for, as I was just saying to Shannon, the Universal School Meals Act, because it's an important piece of legislation. So many children in our country get one secure meal in the schools. And if we don't continue to push for school nutrition and access to meals, the child hunger problem in our country will grow. And as someone who, as a child, both experienced hunger and the shame of utilizing the current system that we have, that sort of puts kids in different class systems, I truly believe that it is important for us to make our school meals program universal, because every child, regardless of who they are and where they come from, whether their family has nothing or just enough, should have access to meals. And I think the most the most kids who are impacted by the lack of universal school meals program are the ones where their families just make a little bit above the threshold in regards to income for qualifying. And sometimes it could just be making, you know, about $100 a year above the amount that qualifies you for that program. And that isn't enough to be able to sustain and feed your family. And so we want to reward families for their mobility, and we don't want to punish people because they make just a little bit more and are struggling to feed their families and feed their children. You know, I recently co-led a letter to cancel $50,000 in student debt, and to expand the moratorium on student debt collection. As you know, I'm the author of the College for All and cancel student debt as well. And so these are a priority for me. And, you know, we continue to have a conversation with our colleagues and now have partners in the Senate with Chuck Schumer, Leader Chuck Schumer, and Senator Warren, and others. I remember when this was a lonely fight with myself, Pramila Chayapal, and Senator Sanders. And now there are many members in the Senate, in leadership, who support student debt cancellation, and so many other members in the House who are oftentimes fighting me to lead letters asking the president to act on this. So I think from where we started 2.5 years ago when I first got elected to Congress to where we are right now, it is a huge achievement, and I believe our prospects continue to look brighter as the days pass.
Yes. Moving to the next questions. Thank you. The next one will be from James Burrows. And then after that, we'll have Amanda, Molly, and Amali. So James Burrows up next, Amanda, and then Molly. Is James with us?
Hi, James.
Hello, Representative Omar. How are you?
I'm good.
Good. I had to get on the video and also click on the sound. So, first of all, thank you for having this town hall. I'll wanted to say a tremendous thank you to you and your staff for your recent partnership with Children's Minnesota, the YWCA, and many community partners around vaccine equity in the community, making sure that we continue to have access to our communities of color who are disproportionately not vaccinated in Minnesota, and continue that to happen. My question is related to that in the sense that we want to make sure that we address the impact of COVID-19 and having the vaccine. But more importantly, we know that health inequities have caused a lot of things: food insecurity, housing insecurity, continued underinsurance, and also systematic racism is playing a heavy role in that in our hospital systems, where our families of color are afraid to even go to our hospitals sometimes because of the impact or the mistreatment that they have because of their race or ethnicity. Is there anything that you plan on doing to addressing those health equity issues? And also, too, are there any continued partnerships or relationships you could see to help community and corporations get more involved in addressing that need as well?
Yeah, I mean, so thank you again for your willingness to work with us in creating the current partnerships that we have in trying to make sure COVID is accessible my son who's 15, since the ruling came down that young children can get COVID, has been struggling to find a location that is close by as mom travels back and forth, that he can go to. And recently, one of the sites that we partnered on with Children's was the closest to him, and worked with my oldest daughter's schedule to be able to take him. So he just got vaccinated. So now our whole family is vaccinated, and it's great. And I've seen a lot of young children, 13, 14, 15, showing up to these sites that have popped up across the district, with your partnership and the work that our office is doing, because they're able to just walk across the street. It's within their community, and that accessibility part, and seeing their counterparts getting it has been a really important piece. But I would say, just in big picture, we continue to advocate, obviously, for Medicare for all, because we believe that addresses it's the remedy to our broken healthcare system. And we continue to push for that, because we understand the importance of making sure everybody has access to healthcare and dental care and mental health and vision care and hearing care. But at the moment, we are fighting both an expansion of access through the ACA, and we continue to push to lower the age for Medicaid access. And beyond that, I think it's going to be really important for us to look at, especially in Minnesota, where you have deep gaps and systematic barriers and racial disparities in all systems, especially in our healthcare system, to continue to have conversations with those who have access to these systems, right? Who are the creators and the profiters of these systems. And I think that there is an opportunity for you and I and others to engage the healthcare systems in our district with the governor's support, in ways in which we can close the racial disparity gap in health outcomes. We know that there is a severe gap in maternal health. Black women die in childbirth, are 4 times more likely to die in childbirth. We know that Black youth, especially male adolescents, suffer with mental health diagnoses, and suicide rates for that specific demographic is extremely high right now. And so it's, really important, as we've created caucuses in the House to look at and do research and study and invite, analysts and doctors and specialists who have spent a decade or more looking into what created these gaps and these disparities, to now bringing all of that information into our community and centering some of those solutions, so that our community can positively be impacted.
Well, thank you. We look forward to partnering.
Thank you, James. Up next, we're going to go to Molly Prismeyer. Molly, are you there?
I am here. Hi, can you hear me?
We can hear you and see you. Thanks.
Okay,
Molly.
hello. Hi, thanks for having this tonight and for taking questions, and thanks to your great team for setting this up and always being so responsive. I wanted to ask about the federal emergency dollars, the COVID federal emergency dollars, specifically as they pertain to public safety spending. We hear a lot at the state, county, and local level about how those dollars will be used for public safety. And as we know, that often means public safety for more policing and funding a criminal justice system that we know harms particularly Black and Brown people. How can we as a community ensure that those federal dollars are spent on the resources we need? And how can we hold state, local, and county officials accountable to that spending?
Molly, what municipality are you in?
I'm in your district. I live in Powderhorn Park.
So Minneapolis. Okay.
Yes.
Municipality, I meant city.
Yeah, city.
Because I represent Minneapolis and then 14 other cities. And that answer could be different depending on which municipality we were talking about. So as you know, like the city of Minneapolis in itself got $271 million in the last COVID allocation. I think they still have money left from the few of the other allocations that they received. I have spent a significant amount of time in going and presenting to our local municipalities about the money that they're getting and the ways in which the money can be used, and then also providing my recommendations on the ways in which that I think this money should be used, and the vision that I and other leaders, as we advocated to get these resources to our cities and districts to be used. And what I found is that some of the municipalities that I represent, so I'll use Edina as an example. When I had my conversation with them, I said, this is the amount of money that you're getting. This is what it can be used for, what it can't be used for. And the first thing they said to me, Congresswoman, in 2 days, we have a community hearing on the ways in which the community thinks we should be using these resources. And so I've taken that and pushed the other municipalities that I represent, including Minneapolis, to say, look, Edina is doing this. They're asking the community. They're not making any decisions on the money and the resources on these dollars until they talk to the community. And, I know that Minneapolis has engaged and started the process of doing community input, but we've also seen reports where the mayor has said, I'm going to use this amount of money for this amount of money for that. And that is obviously coming before you have full community input. You can't make the decisions and then say the community can have a conversation on the decisions that I made, because where is the space, right? And I think it's always important, as this is the way that we engage in creating policy, and what bills we introduce. We obviously always try to have conversation with the community, and grassroots organizations to say, I want to do something on housing. What do you think we should do? And they help sort of draft our legislation with us. And that's kind of what I was hoping Minneapolis would do, that they would follow the model of Edina and Columbia Heights and others in drafting their proposals after they talk to the community. And I feel very disappointed that that's not what's happening. And I think it's going to be important for your voice and the voices of others in Minneapolis to have these conversations with the mayor to say, this money was brought to our city with us in mind, right? This money didn't come with what you might do with it in mind. It came to bring resources to us because we've been the ones that have been impacted by COVID and by the pandemic and the financial crisis that has been created. And here's what we think you should do with the money. And so maybe you should scratch all of your plans, and this is where this money should go. And I obviously think it is really important for us to think about what keeps our community safe. When you have people housed, that keeps our community safe. When you have children in programs, whether it is to play and enjoy themselves, or whether it is to have recreational programs, summer programs, or whether it is investing in a jobs program. I remember, one of our former mayors created one of the most amazing youth job employment programs that exists. A lot of my nieces and nephews have gone through that and found employment through the summer through that program. So how can we expand that? Because it's very limited, right? When I worked at the city of Minneapolis, we used to take some of those kids in to come and work for us in the city because the city was paying for it. And so I think it's important for us to say, here's what keeps our communities safe. And this is where the money should be spent. And this is, where these resources should go. I talked to Willie earlier, a young man in North Minneapolis. There is a severe gap in employment in North Minneapolis for young people. There's a severe gap in employment in South Minneapolis, and where you live in Powderhorn, right? In Cedar Riverside, where, my son resides. And I think it's really important for us to say, here are resources that you're getting that you didn't plan on having. Right? This is extra money. This is new money, and it should be utilized not to create a Step Up summer program. Step Up is the program. I was trying to think what the name was. Right? Like, how can we make sure that we triple the amount of young people we're putting into jobs in the Step Up program than we currently have, right? That would be a really good use of that money. A really good use of that money would be to expand the amount of time our parks are open and recreational centers are open, to help facilitate something with Minneapolis schools, to see if we can expand the amount of hours our kids have summer programming. Maybe we can give vouchers to moms so that they can have, childcare and access to resources, because we know a lot of the moms and dads in these neighborhoods work 2 to 3 jobs to make ends meet, and a lot of young people are left alone. And you and I have both been teenagers. It is a different world when you're a teenager who doesn't have much to do, and your mom and dad are not around. And so obviously there is a way to be creative. There is a way to address the issues that have persistently existed in our communities. And I think it is quite shameful and disappointing that we continue to put resources into the things that haven't actually kept us safe. And we continue to give lip service to equity, lip service to addressing disparities, lip service to, Black Lives Matter, lip service to, community police relations, lip service to safety and care for our communities, without putting dollars into creating a safe and thriving community for all of us. And Minneapolis has the resources. Minneapolis has the leaders. Minneapolis has the ability to put a plan together. And it's going to take all of us to pressure our mayor to think in ways in which that are going to be beneficial to the safety and sustainability of all of us in our city. So I feel like I went on a little rant, but
Thank you.
Thank you.
Thank you, Molly. And we're over the 1 hour mark. Our last question, I think, will come from Amanda. Are you there? Amanda Tran.
Yes, I am.
Hi, Amanda.
Hello. Hi, Congresswoman. Thank you so much for your time, and thank you to the rest of your team for organizing this event.
They making you all say this before they put you on to say nice things about the team?
No. Just kidding. So I saw a Star Tribune article recently about how the racial homeownership gap in the Twin Cities is the highest in the nation. it is unsettling. I was curious as to what we're doing and what we can do in the 5th to address this.
Yeah. So Amanda, that's a really good and important question. You know, as I addressed with James, and you know, with Amanda before you, I think the most, you know, important with Molly, not you, Amanda, with Molly before you, is that we obviously, as a city in Minneapolis and as a district in the 5th and as a state in Minnesota, have had the worst disparities in the country. And, you know, as prideful Minnesotans, we really do enjoy and celebrate when we are number one in things, right? We've been number one on, you know, great parks and other things. We've been number one place to raise children. We've been number one on a lot of things. And obviously it should bring us a lot of shame when we are on the bottom of these lists. And with the same energy that we celebrate when we make it to the top, we should also put that same energy into fighting the disparities that put us on the bottom. And you know, I believe that it is resource allocation that continues to create these disparities. We obviously had redlining and other things in Minnesota that contribute to the lack of home ownership. So many covets still exist in our state and district, and you know, those kind of systematic barriers that have existed for a long time, once they have gone away, should have come with resource allocation to make up for the lost time for these communities. And so, you know, obviously I have a Homes for All piece of legislation that addresses our housing crisis. We've been working really hard in trying to make sure that there are resources to help with first-time home ownership programs that help support people. We've also invested in providing resources to trying to keep people in their homes. But if you look at that study, there is one thing that a lot of people have not like truly paid attention to, and I think it's stated in the article that the gap has grown from 2009 to 2020, right? And if you think about the housing collapse and housing crisis that happened in 2009, 2008, 2010, and how that impacted Black communities disproportionately in our district, especially in Minneapolis. If you think about the wealth gap that has been exacerbated because of that crash, right, and that crisis, all of those things have created the problem that we have right now, and the reason that we are on the bottom. And many of the programs that have been created to address that housing crisis did not take into account that certain communities were going to need extra resources because they have been exploited and they have been impacted disproportionately, that we should not only create legislation to specifically protect these communities, but that we should invest resources into creating, right, like a wealth development programs for an equity development programs for these communities. So one of the pieces of legislation that I recently introduced that I hope will have a hearing and a markup soon is a legislation to create an acquisition fund. Because we know that right now, especially with the pandemic and the financial crisis that it has created, many of the people in our communities that are going to lose their homes, that are going to lose their businesses, are going to be people of color. And if we do not think about how to keep these resources in our communities in the hands of Black and brown bodies, we're going to see a bigger gap in the study that comes out 10 years from today. And I've been one of those lonely voices in Congress, running around trying to remind people that a worse housing crisis is upon us. People have only lost, they haven't gained much of their equity and wealth from the 2009, 2008, 2010 financial crisis. And if we do not adequately address the crisis we're in right now, it's going to be worse 10 years from now for people specifically that are mentioned in the study that we're talking about right now. And so I hope that you and others in our district and across the country will join us in this crusade to try to make sure resources exist so that PIPAC communities are able to own homes. PIPAC communities are able to have the resources that they need, not to just survive but thrive, and that we fully understand that yes, there is an American dream that is accessible, but it's not accessible for everyone. And sure, there are people who are able to pull themselves up on their bootstraps, but they have straps. There's so many people who first need the straps in order to pull themselves up, right? And so these are all the things that we need to invest in and create in order for everybody to have an equal access to that American dream. And again, in one of the wealthiest countries, not just survive, but thrive. So thank you so much for your question.
Thank you, Amanda. Well, Congresswoman, we're well over an hour. We got off to a little bit of a late start, but I think we had a spirited conversation.
Yeah, well, thank you for filling in for me. And again, just really grateful to every single one of you who got on time and sort of stuck around with us. This is, one of my favorite hours of the month, to be able to have these conversations, to directly engage with you. And again, like I said, we are eagerly awaiting our return to having town halls in person, where we can have a conversation, share coffee and hugs, and be able to ask these questions and actually have a back and forth and a real conversation around some of the things that really matter to you all, and the things that you believe I should be fighting for in Congress. We believe in co-governance, we believe in accountability, we believe in transparency, and this hour allows us to be able to engage and to let you all have some updates on some of the things that we've been working on, but to also learn from you and find answers to some of the persisting problems that have existed in our district and across the country. We believe that most of the solutions to these persistent problems are within our community, and we just are a voice that is able to not only vote on your behalf, but advocate and legislate as well. So again, thank you all. Thanks again to my team. to Kendall, Talia, Hannah, and Kelly and others that have been able to put all of this together and make sure that we are able to do this important work that we do on your behalf. So until next time, have a great night. Bye, everyone.